Good evening. Welcome to another conversation on SafeSpace. SafeSpace is a conversational panel that is intended to be free of judgment, free of harassment, and free of emotional harm. We ask that you keep an open mind and be receptive to different perspectives and be okay with not being okay. This evening, I have guests that are UIC medical students, and they are going to share with us a project that they are working on that involves diabetes and how it is impacting the Latino community. Um, First, we have Freddie, we have Sergio, and we also have Omar. So I'm going to allow them to introduce themselves and tell us a little bit about what they are working on. So go ahead, Freddie.
Hi, everybody. I'm Freddie. I am a second year medical student at UIC, as I was just
Say that,
introduced.
Freddie.
Um, hello, everybody. Just a little bit about the project that we're working on. I am in the project with Omar and Sergio in the urban medicine program. And specifically, what we do is we work with community health, which is the largest free clinic. And so what we do is it's called Promotores de Salud. Uh, and we kind of like just a quick synopsis. The main idea behind it is really to empower patients through health education about their own health. So one of the first topics that we discussed, even though there's many other topics, is diabetes. And the idea behind it is really just to educate patients about diabetes, what it entails, what sugar, things like what the sugar level is, how does diabetes work, what are the different types of diabetes, and just to help inform them, so then they can have a higher sense of just so they can empower themselves, so that they can understand the disease process a little bit better. So just kind of a quick synopsis of what we've done so far, and I could pass that on to Sergio or Omar.
Yeah, I can go next. I think he gave a pretty good synopsis of it. My name is Omar, everyone. So Freddie, Sergio, and I are students at UIC, UIC's medical school. We're all in the same class. We're all working on the same project together. And the only thing I could add through that is through that the project is done through the urban medicine program at UIC. So
Thank you. And hello, everyone. My name is Sergio Gonzalez. What Freddie and Omar didn't tell you is that we're also working on so many other projects besides the urban medicine one. We do a lot of work in the community through another organization called MOLA, which stands for Medical Organization for Latino Advancement. So if there's any students on the call who are in high school, college, post-college, and you're looking for resources to understand the process to medical school, figure out if other careers are also an option for you in healthcare, we are going to leave our contact info at the end, because we are also very dedicated in what they call pipeline programs, which are programs that are trying to connect the dots from A to B. So, A is where we grew up, our lives, our families, and B is medical school, PA school, etc. And we are very passionate about that process. So if you have any questions, we're going to leave our info at the end. Thank you.
Thank you. Now, this project that you are working on, how did you come up with this project?
Well, we inherited the project. It's actually like a long-standing project at Community Health. And so medical students before us have done it. And what we did that was kind of different was that we had to do it in the middle of COVID. So we couldn't be in clinic. We couldn't really see even each other. But we still found ways to connect with each other, get to know each other, and develop a community in an online way, the way that you're doing today. So.
Okay. Now, with this project, what do you hope to accomplish through the project? do you hope that it's going to lead to an ongoing program that connects the community and the health industry, or what exactly are you looking for with the project?
Well, one of
this
the
one.
big,
Oh.
go for it, Omar.
I was going to say, Freddie mentioned a little bit about what one of the goals of the project was to start empowering patients to know a little bit more about what they're going through in terms of like their medical illnesses, which is very important. But secondarily to that, honestly, sometimes I don't even see it as a project, more so as of programming, and because we're like pretty involved with the patients, and we've only had a couple sessions with them. But in the past, Sergio has worked on it a little bit longer than us, but in the past, you get to interact a lot with the patients, and just from the couple sessions that we had, we like really like see eye to eye with everyone, and just really get along with everyone else that's there. But to add to that, I was just gonna say that the one of the longstanding goals is for us to pass this program on to the next year medical students, so that they can take it on and just gonna keep the tradition going, and to try to make a difference in this small community.
Now, does the program, will the program like address certain issues of why diabetes is growing in the Latino community? And when the patients find out that they have diabetes, are they provided with nutritional therapy? Are they then provided classes on how to take care of themselves and how to take care of this condition?
Yeah, so the way that the patients kind of end up in in our hands in our program is that they are offered the opportunity when they speak to their providers, and so the providers might say, "Oh, I see that your A1C went up," and the A1C is pretty much like a blood test that they do to check the sugar over 3 months. And so the doctor will say, "Hey, I got some medical students. They speak Spanish. They want to meet with you. Are you interested?" And so, to answer your first part of your question, really the key to addressing, the increased incidence of diabetes in our community is through education. So really, our hope is that we will teach someone even one idea, one concept of their diabetes, care, disease, prevention, pathology, and that they'll go home and they'll say, "Hey, I'm going to share that information because I thought it was so valuable. When I see so and so, I'm gonna let them know, hey, I learned how to count a carbohydrate today. Hey, I learned what the fast acting insulin is like that." When I think about what our program is going to be able to do, that's what I think about. I think about those like quick conversations at the grocery store. Hey, I was just in a class this weekend with these quirky medical students, and they taught me how to do this. They told me that, and just passing that information and breaking those boundaries of knowledge is what's really invaluable to us.
Yes, and also addressing, how the food is very impactful in changing the diet. I don't want to say diet, but your eating lifestyle, to understand that, I have a son who's a type 1 diabetic. And when I learned that there's more to diabetes than, the normal person who doesn't know anything about diabetes thinks, okay, just cut out the sugar. And when we learn about carbohydrates, I was just like, whoa, I'm thinking just more fruits, more vegetables, but there's so many fruits and vegetables that are high in carbohydrates. And, essentially you're taking a class to learn, about the different foods that can raise your blood sugar, lower your blood sugar. So yeah, that is definitely important. And then the boundaries with language, having to translate, because not every doctor has the dual language to explain all of those, different components with the food and the eating.
Yeah, definitely. I think that every patient that I've ever talked to pretty much comes to us with this like idea that they are coming from like a bad breakup with like sugar, because like everyone just said, no more soda, no more juice, no more tortillas, no more rice. And they just come to us and they're like, I literally don't know what to eat anymore. And it's such a process of just kind of like, understanding what diabetes is, how the medicines are treating it, and how like you can modify your diet without having to change it, from like a cultural perspective. Or there's just so many like so many nuances that they just walk in there and like, I've had diabetes for 30 years, and the best I've been told is don't eat rice, don't eat tortillas, don't do this, don't do that. And it's like, when you say no, that just makes people want to do it even more, or that they crave it, or they feel like they're not able to have that. And that's not sustainable in the Latino community or any other community.
Yeah, because essentially it's almost like a culture shock. Food is so ingrained in the Latino culture, and to say that you have to cut, foods off that they've sustained their life with, that is a big, and that's really powerful to be able to provide them with nutrition that they're able to adapt to and not totally change their eating habits and way of life. But those, small little simple adjustments can make a huge difference. I have one question. Now, with developing your project, with developing this tool that's going to help in the Latino community, what made you choose diabetes? Is it something that you saw that there was a rise in Latinos acquiring diabetes? Why specifically diabetes?
So you can correct me if I'm wrong, Sergio, but I think initially, actually, did we choose? I can't remember if we chose diabetes or if the patients chose diabetes. Because we went to okay, good. That's what I figured. We had a health fair that we went to, we tabled at, and in the health fair, we kind of advertised the program and asked what, asked patients who were interested in the program, like, what do they want to learn about? And, we tallied that up at the end, and diabetes ended up being the one that was the most ranked, followed by, I think it was cancer, and I forgot the third spot on the list. High blood pressure was probably it, but diabetes was the first one on the list, so we, wanted to cater to the specific needs of the patients that were going to come to our classes.
Okay, awesome. Now, are you working at specific hospitals or community health centers?
So we only work through we're associated with UIC, but not particularly the hospital, just the College of Medicine. And in terms of clinics, we are only associated with community health clinic up in the northwest side of Chicago.
Okay, in the northwest side. Now, with those clinics, are they provided with free care through UIC or through your organization, or how does this program work for the citizens?
Yeah, so I can take that one too. So if I'm talking too much, you guys can
No,
go ahead and cut me off.
no.
So community health clinic is a volunteer-based clinic that essentially runs insurance free. So patients can come in and see a physician for any specific issue that they might be concerned about. And then after which, there's even they even have like donations in terms of like the drugs that they prescribe to. And they have, I'm not really sure what the extent of the specialists that are there, like to what degree, to what numbers they have a certain specialist, but I know they also have specialized care that they offer in case someone needs to see, a doctor for like a podiatrist or something like that. Something for different kinds of doctors for different kinds of issues. So community health and essentially it's just kind of like a all around clinic that provides care for the uninsured in Chicago, and they have a lot of different communities that actually come to it. We were, because it's located in a certain community doesn't mean that only members of that community are going to go to it. Especially since it serves the uninsured, so you often see patients that are coming from many different parts of Chicago.
Now, with this program, are you noticing more and more young people having diabetes, or is it more older individuals that come to you that have diabetes?
I think that the older patients are braver. They usually come in. From what we saw, when I mean braver, what I mean by that is that a lot of the patients that we saw, some of them were like, "Hey, I don't have diabetes, but my granddaughter does, or my niece does, and I'm here to learn about diabetes for them, so that I can go home and nudge them to come here, or at least share with them." So I think that
Hmm.
that I can't really answer as to like whether people are coming in younger or not, but I will say that diabetes is a disease that knows no age, and young, old alike, especially in the Latino community, are at an increased prevalence for it.
Oh, okay. Now, with that, do you guys provide? Because I know having to address the eating habits of the community. Are they provided with some type of guide to offer them alternatives to like certain meals that they have been accustomed to eating, or is there a nutritionist that can provide them with that information, or are they just told, okay, maybe instead of tortillas every day, maybe once or twice a week, or they're told like, okay, maybe try an alternative to those foods that are high in carbohydrates?
Yeah, I can talk about this one, Sergio Nomar. So, so in the past, the way it worked, correct me if I'm wrong, Sergio, but the medical students used to carry out cooking classes. So essentially, they would bring a bunch of different ingredients that were readily accessible and very common household staples and things like that, and they were able to make like a kind of like a class about, oh, this is healthy food that you can create through these ingredients. So it kind of addressed some of the things that you're talking about. Since like, because we kind of touched on it a little bit because of COVID, we kind of have to adjust the way we do things. But essentially, the way it works is that we kind of have a lecture series about diabetes. So diabetes is kind of a broad topic with a lot of different things, as I'm sure you know. Which diet that can encompass like a whole hour, 2 hours, as I'm sure we're all aware. And so the way it kind of worked for us was that we kind of initially did like an intro, like, okay, what is diabetes? Like, how does diabetes work? What's the difference between type 1 and type 2? I know you mentioned type 1 a little bit earlier, and there is a difference. And so that's kind of how we started off. And then the next lecture series was kind of like, okay, a little bit more like numbers. Okay, so the next lecture was about like, oh, what is the glucose level, things like that. How do you measure your sugar? And so the idea behind our program, or the way we're doing things with community health, is that we want to continue this lecture series. So then ideally patients that came through the first two lectures will also show up to the third and to the fourth, and they can have this continuation, or we can have this continuity of patients continuing to be educated. And the next topic that we were going to talk about is actually diet. So the community health, if I'm not mistaken, Sergio, they have nutritionists, correct? Yeah, so community health does have a nutritionist on staff, and so that can help. That's one way to help the patients. But we also do. We are planning on educating patients about different ways to adjust their diet, so then it could accommodate their different diabetes, the diabetes that they have or don't have, or for family members. And one of the things that Sergio was talking about earlier was kind of like, you can't just tell patients like, okay, that's it, no more. For example, tortillas is very common in Latinx community, so you can't just be like, okay, no more of that just because it's high carbs. Like, yes, high carbs, but one thing to keep in mind is also like moderation. Like, you can eat like you can eat a lot of the food that that we're so used to, accustomed to eating, but you just can't eat it in excess. Like, instead of serving like 4 or 5, well, maybe that's excessive, but like instead of serving yourself more portions, have less portions of the same food, so you can still continue to have that food that you like, but it's just a lot less. And so those are the kind of things that we're
Yeah,
planning
we can't
to
have carnitas every day. Okay, we have to
yeah,
limit carnitas
or maybe
to
don't have 4 plates, or you know what I mean, or like
right.
a second or third plate, have like that one plate, to satisfy that, you know Yeah. So those are the things that we have for the future planned out. Definitely diet is something very important that we want to spend a lot of time on. So that's kind of next in our lecture series.
Oh, great. Thank you. Now, also with this program that you're offering, are you noticing that you're addressing more on an individual level, or are you noticing families are participating in this program?
I think it's still on an individual level. The program in the past very much so followed that kind of family unit when we could gather together in person as uh, with like no restrictions on occupancy and things like that. But now, like with being able to navigate, occupancy restrictions, spacing in the room, we really just kind of have to unfortunately limit people to be like, hey, only bring maybe one other person from the family. But I think that um, ideally it would be the whole family so that everyone together can advocate for that one family member that has diabetes when they go home and they see those things happening at home and they can say, hey, remember what we learned in that class? Why don't we do this? Why don't we try that? But I guess we just play it by ear until we can figure things out in terms of in the spring doing it outside or things like that.
Okay,
So I was going
because
to add to that.
family support is so important. Yeah. Oh, go ahead, Omar. Go ahead.
Oh no, I
I
was just
think we
gonna add
froze.
going based off of what you said, we have had some couples, and I think from that it just kind of stems. Well, initially, I think the couple that we did have was there because I think they both had diabetes, but I wouldn't shy away from the idea of like someone going in with their partner just because they want to be supportive and learn more about what's going on with them.
Now, are the lectures, are they in person and are they offered virtually, or how does that work?
So the lectures, the design of the lecture was something that we did a lot of research on. I think we spent the first couple of months, even before we went into clinic, figuring out like um, how to try to educate our community in ways that were culturally informed, in ways that weren't perpetuating like stereotypes, and then also in ways that were like neutral in terms of literacy level. So we had to navigate all these things in terms of even like reading like past lectures that might not have been made from people that were community stakeholders. So it might have just been like other medical students in the past who really didn't have a connection to the community. They just kind of knew about diabetes, were part of the program, put together this kind of like very canonical, very academic type of educational perspective. And so we really had to like figure out like things as simple as like, what if there's different literacy levels in the same room? How are we going to navigate making sure that everyone gets the same point and nobody gets left behind? How do we navigate like if we're going to assess the group? And what if like someone might not be able to answer the questions on like a written test? Like everyone should still have that opportunity to assess themselves. So how do we do that? So we really spent a lot of time thinking about that, being intentional with it, and we developed a very interactive kind of like group approach. So even if like for example we did a survey, it was through like a group setting. So for example, we would read the question out loud, answer it. Obviously, like everyone would answer their own answer, but it would be like we would slow the pace down of surveying. We linked all the topics to the survey so people could see their growth very concretely in the sense of like, okay, if we walked into lecture and question one was, what is A1C? When we hit that topic, it'll say A1C is, and this relates to question one. So people could be like thinking about, okay, I remember when I answered that. Yes, that's what I got. Because we figured that that's how we would probably get people most engaged. was to just give them like very concrete information, break it down, slow it down, and connect it to like a survey mechanism.
Okay, now, when you are working with them, are they giving a general plan, or do you try to personalize it to each individual that's participating?
Do you mean like was the curriculum tailored to like each individual member, or what did
So
you mean?
for instance, like with their eating plan, is it just a general plan that's given to them, or is it specific to, okay, maybe we have someone who seems to have hypoglycemia? Am I saying a hypoglycemia, where your sugar is too low? You know, you have a constant reading of your sugars being high, or if you have a constant reading of your sugar is being low, certain foods you should eat. Is it tailored to the individual person, or is it just general information that is being provided to them?
So I think it would be a little bit of both, because we provide the tool blocks for like the very specific, but everyone was exposed to it. So it was like everyone's going to learn about type 1 diabetes, what the symptoms are, how it's treated, the pathology. But then we emphasize, okay, like, Omar was like, okay, I'm gonna do a question in the crowd. Does this apply to type 1 or type 2? Oh, type 1. Okay. So I think that it's a little bit of both of what you're saying. Like the tools are specific, but the exposure was universal, if that makes sense.
Yeah, I mean, I could add to that too. I think that's perfect what Sergio said. Like, I think it's like we have like this kind of broad, presentation, or like what we want to teach to the different patients. And it's like Sergio said, it's universal, because everybody's gonna learn what we kind of initially came in to talk about. But then when we have interactions with the patients while we're speaking and while we're teaching, they have their unique questions that are personal, right? They're like, okay, well, they might say like, oh, well, I have this situation, and then we have the time, because we set out a class like that's for them, and then so we're able to like, okay, well, you have this question, and we try to address that question. So we try to like make it unique in that way, where they're like, if a patient has like a specific question, we try to address it and try to tailor like kind of what we're teaching around what they asked. And so we kind of like modify, like we try to like modify our presentation as we go to try to tailor it for the individual patients. But initially we come in with something general, like, okay, like for example, like if you have, like how you were mentioning, hypoglycemia, what do you do? Like, okay, well, that means your blood sugar is low, so you need to make sure that you get some sugar, some glucose into your body. And so that's kind of universal, because everybody learns that, like, okay, now I know in the future situation, if I have like a low blood sugar, hypoglycemia, what I should probably do. And so that's universal. But then if a patient has asked a question about like a specific food that they like to make or something like that, then maybe we can try to like personalize it for them and try to answer that question. So like Sergio said, it's pretty universal, but we try to make it tailor it for them as much as we can.
And I really want to emphasize the point that Freddie just made. Or sorry, I think there was a lag. I'm sorry.
No,
Were you
no, no, no.
speaking?
Go ahead. Go ahead. Go ahead.
I just want to say, I really want to emphasize the point that Freddie made. In working with patients, I was most surprised to see patients come in with such a like concrete arsenal of like questions and like case presentations, because it was like the minute we said, are there any questions, and they were like, yes, I have a question about this. I remember I have a family member who has this. Like they were just like ready to ask these specific questions, go back on and be like, listen, that question that you've been having that nobody's answered in like who knows how long, I just asked Omar about it. Like remember when you kept feeling like sweaty and you weren't feeling well, that means your sugar was low. I asked him that. Like I just remember Omar had like a very difficult set of slides, because his were like the type 1 versus type 2, and he just kept getting like stopped every minute because it was like, wait, and what about this, and what about that, and let me tell you about like this family member that I have, and he just kind of like kept switching, like, okay, like this is on the slide, but this is your answer to your question. This is what it would apply to everybody else, and then it was just patients really, truly are the best students. Like the people in the community are the best students because they're so curious and they just have so many questions that they want to ask.
Also, do you provide them support with when they're going to the doctors, if they have certain questions that they're not sure how to address to their physician? Do you provide them support?
So yeah, so I think the biggest thing we do is try and have patients feel empowered with their health, and by that I mean so just to backtrack a little bit, to the conversation we're just having about general health advice, personal advice. Just in general, it's a little bit difficult to give personal health advice without knowing, like their sugar levels and their health history, everything else. Patients have questions specifically tailored to themselves, but it's incredibly difficult to answer a question when you're not their doctor and you don't know their entire health history and what medications they might be on and things like that. So in general, it's a little challenging to give advice like that. But with that being said, we definitely excuse me. With that being said, we definitely try and have them feel empowered by encouraging them to go ask these questions to their doctor. So we say, like, like this question that they're having, they're asking us is very important, and it should be asked your. We encourage you to ask your doctor, so that you can find out more about this, because unfortunately we can't answer it. We don't know what's going on, or we didn't know what's going on when you were having maybe the symptom. So it's important for you to ask your doctor, because it could be like a side effect of medication. And we had a session where someone was asking us about why they had diabetes after surgery, and it's very challenging, like I said, to answer some questions, just because this was like first session, so we people that we met maybe for the second time, and it's a little bit of a struggle to answer a question like that.
So essentially, you would suggest them to attend. Maybe they need to see an endocrinologist, or maybe they need to just, it's not necessary to go to the doctor. You just need to maybe visit a diabetes nutritionist. Do you provide them with that type of information, where maybe like, oh, you need to go to the doctor, and you're like, no, just you need to go see maybe the nutritionist who can, advise you on like changing your diet, or maybe it's severe, they need to go see their endocrinologist. Do you provide them with the different services that they need to seek out?
We don't specifically.
Oh, sorry, Omar. Sorry, I think I have a lag. I'm sorry. Go ahead, Omar.
No, go ahead.
I was just gonna say that one of the trickiest things was that a lot of the questions that patients were asking were for other people that weren't there. So it was even harder to be like, okay, go see this doctor or that, because it was like people were actively advocating for people that they knew who weren't there, and they had that question for them. But just generally, all the patients that have been in our classes already have connections to like the nutritionist and the primary care doctor, because they're patients of community health who are already actively seeing like the pharmacy student to just maintenance checks on dosages, the nutritionist for just like long-term plans, and then PCP for like just general in-house care. So the good thing is that the patients that were there have those connections. The bad thing is that they were asking questions for people who we don't necessarily know if they are patients of community health or have primary care doctors elsewhere.
Now, also with diabetes, it's very important that they take care of their vision, and they also take care of their feet for some reason. Do you explain to the community like why these different body parts are so important? Well, everything is important when it comes to diabetes, but they definitely have to pay close attention.
Yes, we actually even made videos on like those specific topics, like diabetes foot care, why it's important, what to look out for. Um, just because like we wanted patients to have those resources after the call, because I speak from like personal experience with having family with diabetes, and I've been in those consult rooms, and the patients just walk out, and it's like so much information. They're like, "Oh, you need to check your feet. You know, you need to do this. And you need to eat that. And you need to take this medicine." That it's just like it's overload. So we thought it would be good to
Mhm.
like leave leave that information in perpetuity, and be like, okay, just in case you need to access it, we're putting these videos on this Google Drive that you have access to as a patient. Um, because yes, like diabetes foot care, especially in the working class community of Chicago Latinos, that they might work two jobs, they might not check their feet for hours and hours and hours.
Mhm.
So it's so invaluable that just these little reminders of like, hey, I know you've got two jobs and you're, part of like the carpool of family and all this, but your feet care is so important. Your eye care is so important. So yeah, we just try to do everything we possibly can to just make an impact.
Now, with that, how often is the community actually visiting the doctor? Are they waiting for, an emergency only, or are you making sure that they're keeping like regularly scheduled checkups, their primary care physician? Because with the middle class, with the working class community, you don't necessarily have time to take off. I want to go get a checkup today. We always wait until that it's a dire emergency before opposed to just regular maintaining checkups, and especially with diabetes, where you should be getting a checkup maybe a couple times a year.
Um, I think that we're very privileged with the patients that we work because community health does an amazing job of um, just really plugging them into like their care system, because they see the PCP, they see the pharmacy student, they see the nurse practitioner. So they're just they're just always in line like with their care. But I think that generally for the general Latino population, it's the situation that you described, where it's the last minute. Maybe there's already a cut on the foot. Maybe there's already an A1C above 10. Um, so I think that in the larger conversation of Chicago, healthcare for Latinos with diabetes, the situation is unfortunately uh, leaps away from where it should be in terms of patients having regular checkups, having regular even refills of their medication. I think that's one of the biggest challenges in care is that diabetics will self juggle prescription times. So, for example, if they have a copay, even if they have, you know, part of it is paid for and they have a copay and they can't afford the copay this month, they'll space it out. I've seen people where they're like, okay, I've got metformin for 1 month, but it has to last me 2 months because I'm going to take it every other day because I can't afford that next refill, or insulin. I'll take the injection today, but then not tomorrow, and it's just uh, there's so much that needs to be done still in Chicago to fill those gaps, and yeah, that's what I have to say about that.
Mhm. Yeah, it's a lot of health disparities, and yeah, that definitely Yeah, that definitely is something that is really important and seems to be going unaddressed. But another issue that I'm interested in with the diabetes in the Latino community, how does that impact mental health? Because that, the responsibility of taking the medication, the responsibility of having to actually understand what's going on with your body, the having to deal with the financial aspect of not being able to afford your prescriptions, not understanding what's happening. So that does weigh in. Do you address those issues also?
Yeah, our like presentations have a very we try to approach like the emotional aspect of this disease as well. Every time that we start a lecture, we have kind of like a reflection piece where we try to connect patients with the uh, emotional component of diabetes care, like you mentioned. So I think that every person that I've ever worked with that has diabetes or is a diabetes care member, they can think of a holiday where someone with diabetes didn't feel well, a doctor's visit that was difficult to go through. And so we try to like open up our lectures by being like, listen, we might talk about the pathology of diabetes, we might talk about, X, Y, and Z. And while it might get maybe boring after an hour, you've got other things going on, you have a life, remember why we're here, and remember the intention that you set when you got here, which was to try to learn something, try to change something, try to make peace with something. So I think that 100%
Mhm.
the emotional slash mental health component of diabetes is so entrenched in the disease itself, um, especially in the Latino community, where a lot of times, from a cultural perspective, people will sometimes say that, how do I say this? There's a cultural kind of understanding that sometimes people get diabetes if they go through a very strong emotional experience. So I will speak to patients sometimes who will say, "Oh, when my mom passed away and things were really difficult, that's when I got diabetes." And a lot of times there's an association that mental, mental health slash emotional trigger created diabetes in their body. And so a lot of times we need to unpack that to be like, what was going on at that time? How was your health at that time that you associate the diabetes with the passing of that loved one or that strong emotional trigger? So yeah, diabetes and the emotional component of it in the Latino community are extremely close knit.
Wow, yeah, that's definitely something that it has to be addressed. So this has been a very interesting conversation. I am so glad um, of the work that you are doing in the Latino community with addressing diabetes. This program, before we head out, um, can you provide us with more information on the program so that we can refer more students, um, find more, patients? What is it that we can do to promote this program?
I would say the biggest thing would be to see if you're eligible for care at community health. And for us, we're a very small piece of the diabetes care picture, especially at community health. So if patients that are listening or that simply just go and see if they're eligible or someone that they know is eligible, that will already get their foot in the door of getting, a session with us, free medication, primary care provider, nutritionist, pharmacy student, just goes on and on, dental care, vision care, all to address diabetes care. So I would say the biggest plug would be for patients to go to community health to see if they're eligible. And I hope that that we were able to provide just some, I guess, picture of what Latino medical students are doing for the community in Chicago.
Yes, I'm proud of you guys. This is definitely, I know you don't call it a project, but this is really impactful. Too bad we can't have a program like this in every section of the community, because you're located northwest side of Chicago.
Yeah, I would say the clinic is located northwest side, but most patients come from Belmont-Cragen neighborhood.
Okay. Yeah, because a program like this, you need one in Little Village, one in Pilsen, just, south side of the city. So many different areas that are being hit hard, and they don't have access to quality health care, as you guys are definitely providing. And not only that, the information that you are providing to the community concerning diabetes and their health and their, the mental health aspect that you're also addressing. Thank you so much for that. Can you also provide us some more information on the organization that you are affiliated with?
Yeah, so Freddie, Omar, and myself are part of MOLA, which is the Medical Organization for Latino Advancement. And we support students trying to get to medical school. So if anyone is listening and they have a family member who is on that journey, please, just Google it. It's the easiest way to look at the organization up. It's a network of over, I think, 400 physicians and over 1,000 students. So if there's any people on the call that are trying to get to medical school, I would say Google MOLA and also Google UIC Urban Medicine Program, because it's a good pathway for students of color like us to work with the community, find their, their niche, their calling, and giving back to the community.
Okay. And also, you said the University of Illinois, Chicago.
Yes.
Urban Studies or Urban Medical Studies?
Urban Medicine Program.
Oh, Urban Medicine Program.
Mm.
Okay, thank you so much. And I wanted to thank everyone for tuning in and learning about this great program that's being offered to the community by our Latino medical students from UIC at Chicago. Thank you for tuning in. And again, take a moment to shine your light in the dark. Thank you so much.